What was missing from my daughter's concussion treatment? Why did 3.5 months of concussion-specific physical therapy not help her? Let me show you a chart I came across the other day, created by the doctors who did help her at the UPMC Concussion Clinic in Pittsburgh. It shows the two huge pieces that had been missing from her concussion care. Here's a little background information for this chart. At UPMC, Dr. Collins and his team break concussion out into 5 different types or clinical profiles. A patient can have just one type, but patients usually have at least 2 types that need to be treated. This chart shows you how often each clinical profile occurs. Keep in mind that at UPMC they have about 20,000 patient visits every year just for concussion, so they have a lot of data to work with. Now, if we look at this chart, we see that collectively vestibular and ocular take up 34%, meaning that 1 out of every 3 concussions impairs these systems in the brain. Thankfully, there is a growing knowledge of this, and many patients are now sent to vestibular and vision therapy. My daughter, Maria, was sent to vestibular and vision therapy after her concussion. So why didn't it help her? Well, if we look at the chart again, we see that the 2 pieces that are actually the biggest are 2 problems that Maria did have, but that were never addressed by any of her doctors until she landed at UPMC. And those pieces are anxiety at 30% and migraine at 25%. At UPMC, my daughter was given targeted active treatments to address those issues, as well as continuing to work on the vestibular and some of the vision issues that she had. Once all of these pieces were put together for her, she made a dramatic turnaround and was better in 8 weeks. Now, on the flip side, I just listened to a heartbreaking conversation among a group of concussion patients whose doctors only addressed anxiety. And they did it in a way that was frankly insulting and ineffective. These patients had similar stories of being told to rest after their concussion, receiving no treatment besides that. And when they still had symptoms months or years later, their doctors, in their words, chalked it up to anxiety and depression, told these people that their symptoms were, quote, all in their head, as if they were just making it up, and told that what they needed was some antidepressant medications. Now, these people were never offered any treatment or diagnosis for vestibular dysfunction, vision problems, memory problems, neck issues, nausea, light and noise sensitivity, and a host of other physical and cognitive issues that are often part of concussions. And so they are still suffering years later. So, what are the missing pieces in your concussion care? Make sure you find a concussion specialist or a clinic that treats all of the concussion puzzle pieces. If you need help, don't hesitate to reach out to me. This is your friend, Faith Enriquez, signing off from this week's Concussion Coffee Break.